this is serious disease. A lot of people get sick, and a lot of people get very sick. And even if we said, well, okay, we recognize that, we're just going to have to overwhelm our healthcare system, and we're going to have to figure out our way through that. You don't want to do that because of the number of people who are going to be severely ill and who will die from this. So it's
yeah.
But on the other hand, we can't have as many people as are out of a job for that long, right? So
yeah.
we need to we can't maintain the kind of precautions that we're doing now for 6 months, never mind a year or 18 months. So we're going to have to feel our way through it. On the other hand, the good news of the day today is there's preliminary evidence today that there are 2 drugs that might work in treatment.
Taiwan is so quick to recover. Did we react too slowly?
I think we, I don't know that there was a right thing. Taiwan's had a very effective response. So has Singapore. Some of it is, some of it is healthcare preparedness and strength of the public health system in both places. Both places have much stronger public health systems than we do.
Do you think we will build a hospital like China did? Do you think we'll build?
Oh, heavens, we can't. No, we just have no capacity to
throw up a hospital or turn a military base into hospital beds. We won't be doing that.
Well, I think we might be doing that. I don't think we'll be building a hospital, but I think if you look at what's happening in Italy, people are using, stadiums and other non-traditional places for people who are hospitalized. And so I think we will certainly be stretching out of our, how our hospitals are usually organized to care for patients.
Okay. Have you heard, Dr. McGeer, that you should not take Advil, only Tylenol, if you have COVID-19?
Well, so there's good reason to prefer Tylenol over Advil for most people. You do have to be careful not to take too much Tylenol because you can poison yourself with Tylenol, but Advil and other nonsteroidals do upset the stomach lining. I don't think there's enough evidence at the moment. I think the medical expert consensus is that there's not enough evidence at the moment to suggest that there's nonsteroidal anti-inflammatories that lots of people take chronically for things. And there are some other drugs that people take for heart conditions and high blood pressure. And there's been a theoretical suggestion that there may be some harm associated with them, but it's just theoretical. And I think the consensus at the moment is now that it's not enough evidence to suggest that people should change what they're doing.
All right. Okay, so the good news is that there is potentially 2 trial drugs that look hopeful.
Yep.
But that's symptoms. Or is that cure?
No, that's cure. So that's that they appear to help people recover faster. And they may work also in preventing illness and things like nursing home outbreaks where you're worried about transmission.
Yeah. Okay, so that's like a repression drug, is it? Or it's a cure?
Sorry? It's a which, sorry?
Is it repression like they did with AIDS, or is it a cure?
It's a cure.
Wonderful.
It's a cure.
Wonderful. Wonderful. Okay, we will...
In combination with your immune system is a cure. So it's the equivalent of taking an antibiotic.
Okay, very good.
When you take an antibiotic, it's hard to separate out whether your immune system is doing the dealing with it or whether the antibiotic is. It's the combination that works. So this is the same thing. It's partly your immune system responding, but it's the antiviral helping your immune system deal with it.
Okay. Well, we're going to stay tuned, and our studio is going dark for the next 2 weeks, but we'll call you back in a couple of weeks, okay, for an update. Thank you for liking, commenting, and subscribing. What do you think about today's topic? Let us know in the comments.